The COVID-19 situation is getting worse in New Mexico. Let's take a hard look at that next on I'm sure by now it's not news to you that the COVID-19 pandemic is worldwide. In fact, COVID-19 has affected every country on every continent except Antarctica. There have even been 13 cases on Greenland. A few countries are keeping their daily counts controlled, but even New Zealand, an island with essentially closed borders, has sporadic cases. And most countries, particularly those with large populations, are experiencing an overwhelming number of new cases per day. The United States tops that list. New deaths per day varies dramatically from country to country. Note, this is a log linear scale, which allows us to see a country with a high number of new deaths per day, such as Brazil, with about 1,000 new deaths per day, and countries with fewer deaths per day, such as Israel, at 5 deaths per day. The absolute numbers, however, are not as important as the trends, because in any country, deaths could skyrocket without warning due to the effect of exponential growth. Notice that the United States, after a period of decline, has begun to experience a rise in daily death counts. There are close to 14 million cases worldwide. There are close to 600,000 dead. These are almost incomprehensible numbers, so let's put them into context. On the right is a list of the top 10 causes of death worldwide. At first, it seems that the deaths from COVID-19 are substantially less. But remember that we have not yet experienced an entire year of COVID-19. What might it look like by the end of 2020? No one knows, and it is critical to remember that. But assuming we do not get a vaccine that can be disseminated widely and that people agree to take, and assuming we develop no other meaningful therapies, COVID-19 could well fall into the 10 leading causes of death worldwide by the end of the year. 18 states, almost 40% of the country, are estimated to have uncontrolled spread. The majority of other states are trending poorly or in a state of caution. Only 5 states are currently trending in the right direction. Another good way to picture the current state of affairs is to look at cases at the county level, divided by the population. This lets you see the variation within states and between states. Within the Sun Belt, the vast majority of counties are experiencing high rates of new cases. Not only are there a lot of cases, but the rate of rise is accelerating. 40 of 50 states, 80%, are experiencing substantial rises in cases. At the bottom of this graph, you'll see New Mexico's death rate appears not to be increasing, and we'll take a closer look at that in a few minutes. For now, look at the other states. In many states, the death count is rising. In some, the rise is so fast there is a concern about where the bodies can be placed. An average of 720 Americans are lost to COVID-19 per day. That devastates families and communities. But we need to understand whether that number is really as bad as it seems compared to other causes of death. In roughly 5 months, COVID-19 has become the 6th leading cause of death in the United States. But remember, I said 5 months have gone by. Assuming for the moment that we do not have a widely disseminated vaccine and we don't have therapies that significantly lower the mortality of the SARS-CoV-2 virus, it's eminently feasible that COVID-19 could become the third leading cause of death in the United States by the end of the year. Death is only one measure of the effect of COVID-19. A bigger concern is the capacity of the healthcare system to manage all sick people who need care, whether due to COVID-19 or not. For many reasons, monitoring hospitalization rates is critically important to public health efforts. So let's take a look at the national hospitalization data. This is a graph of cumulative cases and deaths in New Mexico. The red dotted line shows the growth rate that would have occurred without the public health measures that keep people from spreading COVID-19 through the air. Until recently, the climb was steady. But then, something changed. Now, the slope of the rise in cases has increased. Deaths occur about 2 weeks after cases are identified and predictably followed the same curve. But now, deaths have fallen off. People are still dying, but not dying at the same rate as new cases are increasing. We'll explore why this is a bit later. Now let's take a look at some other trends. In this graph, we see the average growth rate using a 7-day average to smooth out spikes and dips due to variability in reporting. Since April, the growth rate was trending down. Then, in late June, things changed. Why? We can only speculate by looking at the context. Beginning in March, we had what some call the lockdown. From a biologic perspective, a lockdown just means keeping people out of each other's airspace because COVID-19 spreads from person to person through droplets and potential aerosols in the air. And as people stopped infecting each other, the growth rate fell. Next was the first relaxation phase, allowing more people to come in contact with each other. This was also the time of the mass gatherings we saw related to social issues. This was followed by 2 phases of relaxation that allowed people to come into much more contact with each other at shops and restaurants, etc. At each phase, we knew that we still needed COVID-safe behaviors to prevent spread. For many of us, the question became, if this reopening strategy, which depends on a cooperative populace, is not successful, when might we see the trends reverse? Some, including myself, predicted in this unfavorable scenario a rise starting somewhere in mid to late June. Unfortunately, this rise, in fact, did begin to occur, leading to the next phase, which we are in now, of reimposing some restrictions. We can see this trend is reversed and gone in the wrong direction in several measurements. This graph shows the number of people out of the total number of cases to date who are not considered to have either recovered or died. We could consider them in some sense the active cases. The same inflection point is seen. Active cases are rising for the first time in months. This graph shows new cases per day, with the trend line being a 7-day rolling average to smooth out daily variation and reporting. Again, at the predicted mid-June point, there is a sharp inflection upward. The jump in the rate of new cases is seen in every region of the state except the Northwest. The Northwest is unique in that the Navajo Nation and McKinley County were able to institute aggressive measures, including curfews and, at one point, closing the city of Gallup to all traffic. But even the Northwest has a sustained daily increase, and there is early evidence that rates may be starting to rise. A common misconception is that the rise in the number of cases is solely due to an increase in testing. In fact, The percentage of positive tests is showing an increase. It had been decreasing, then holding steady, and after the point of the predicted rise has increased. If this trend were to continue, and I'm not saying it will, only if it does, by the end of the month, we could be back up to a 5% rate of positive tests or higher. 5% is considered an important threshold. Here's why. The World Health Organization estimates that as long as the positivity rate is at or below 5%, governments can assess how safe it is for people to interact with each other, or, in other words, figure out how much a society can reopen. If a positivity rate is too high, we are probably testing only the sickest patients and are not casting a wide enough net to know how the virus is spreading in the community. 2/3 of states are currently above the 5% threshold. But so far, New Mexico remains below at just under 4% positive rate. In many states right now, ICUs are run like wartime hospitals, with patients stacked next to each other and doctors and nurses and respiratory therapists taking care of far too many patients. In these states, it's a nightmare scenario with healthcare workers thrown into essentially battlefield conditions. Unlike the federal government, New Mexico makes its hospitalization data available. While luckily New Mexico is not facing the nightmare scenario today, we are seeing a rise in the number of COVID-19 related hospitalizations. You may remember from an earlier slide that deaths are a lagging indicator. The same is true for hospitalizations. The observed rise is consistent with the prediction that cases would rise after the middle of June if, after the reopenings, people continue to exhale, sneeze, and cough more virus into shared airspaces. One favorable trend is that fewer hospitalized people need a ventilator. Men and women consistently become infected equally. On the other hand, the virus does discriminate based on gender, who it kills. In every age group under 80, a greater percentage of deaths are in men than in women. The big story about who gets infected, however, is the age effect. Last May, the distribution of cases across age groups looked like this. Things are different today. Unlike last May, by mid-July, the curve has shifted toward younger age groups, notably those in their 20s and 30s. 44% of new cases occurred in people under the age of 30. This is up from about 20% at the beginning of New Mexico's epidemic. Among the total number of cases, more than 50% have occurred in people under 40. Okay, that's cases, but what about deaths? Here, there's a big difference. The younger groups are dominating cases, but the older groups are dominating deaths. Under the age of 50, fatality rates are relatively low. I say relatively because 1% is still 10 times higher than seasonal flu, for example. Because more cases are appearing in younger people, and younger people have lower fatality rates, we see the effect in our overall case fatality rate over time. It's easy to focus on death. It's a feared and terrible outcome. But it's not the only outcome that matters when looking at the rising number of younger people with COVID-19. More than a third of hospitalized COVID-19 patients are under 50. The course of disease during the hospitalization can be weeks to months long and devastating, leaving one with major long-term physical and emotional damage. And more young people in the hospital means more stress on an already overwhelmed healthcare system. Hospitalizations are just one of the bad outcomes younger people face. Younger people tend to be more mobile. They may feel no symptoms for the early stages of the disease, making them much more likely to spread the virus to people who are at higher risk, such as parents and grandparents and teachers. There is a high risk of spreading COVID-19 to anyone with whom they live, spouses and children, as same-family spread is a major factor in propagating this epidemic. One may not die, but that doesn't mean life is rosy. Heart failure, lung damage, even when symptoms were mild originally, blood clots that lead to strokes and amputations. Many are finding they have cognitive problems with their thinking for months after recovery, as well as a chronic fatigue state. This virus seems to get into every cell of the body, and studies indicate that in some men, the SARS-CoV-2 virus, the virus that causes COVID-19, caused them to become sterile. Finally, let's not forget children do become infected. Nearly 14% of cases to date have been in people under 20. Over 750 kids under the age of 9 have been infected, and the rare but very serious condition called multisystem inflammatory syndrome of children, or MIS-C, has affected 2 children so far. To sum up, at the time of this recording in mid-July, the COVID-19 pandemic is getting worse in the world, in the country, and in New Mexico. But trends can flip without warning, and sometimes without obvious rhyme or reason. And in a week or two, the story could be better, especially if people follow COVID-safe practices. I'll be back with more updates as conditions change. Thank you for listening, and I hope you all stay healthy.